In Jackson prisons, there have been 3,900 cases of coronavirus. The Department of Corrections is saying they're doing the best they can, while the mother of one former prisoner is saying much more can be done. There have been almost 24,000 coronavirus cases across the 28 facilities in the Michigan Department of Corrections system. At G. Robert Cotton Correctional Facility in Jackson, there are 372 employees and almost 1,600 prisoners. With 1,700 tests administered since the start of the pandemic, there have been 900 positive cases overall at the Cotton facility and 4 prisoners who have lost their lives due to the coronavirus. But according to the Michigan Department of Corrections, they're doing the best they can to keep everyone safe, including weekly COVID tests.
Continue to adhere to those strict protocols and guidelines in terms of mandating that prisoners and employees wear masks at all times, that they practice social distancing, that we're encouraging hand washing, making sure that we have adequate supplies of soap, hand sanitizer, all those kind of things available throughout the facilities, making sure that we're doing temperature checks and symptom checks on all of our staff when they begin every shift.
I spoke to Janice Green, whose son Gerard was just released from the Cotton Correctional Facility. She says there's no good way for social distancing to happen inside those walls with 8 inmates per cell and 160 people per unit.
There are so many vulnerable, sick people in these places, elderly, and that are documented and that they're not receiving adequate care for COVID. I mean, a pandemic in a prison is, it's like a petri dish. It could just spread like crazy. So, especially when people have no room to social distance themselves, they don't have proper spaces where they can really get cleansed.
According to an advocate group for inmates' rights, the Michigan Department of Corrections statewide has a big problem with how they're handling it, not just Jackson, with 127 deaths statewide.
They're scared for their lives because they don't believe that staff or the people who are incarcerated there are following the safety protocols that they're supposed to be following. We also hear from clients that they are being that healthy people are being housed with people who are sick, are being housed with people who have symptoms.
But the Department of Corrections says they take swift action when there is a positive case.
We are testing every week, every prisoner, every employee, so that we have a very good sense of who's positive, obviously who's negative. We can separate those individuals, quarantine the positives, identify close contacts, keep the negatives away from both of those groups so that we don't have further spread.
Not all of the people in the facilities can stay there, though.
The correctional officers come home, they go back and forth every day.
Mm-hmm.
They possibly can contract or, possibly bring COVID out. People are coming back and forth home. They're not going to be there forever. So being, more proactive and spacing these places out, having better sanitation, healthier foods, things that all can be helpful for a pandemic.
But Gouts said the department's hands are tied for early releases and that they can't use the virus to let someone out early.
There's no such thing as early parole in Michigan. There's a voter-initiated law called Truth in Sentencing, which says that you have to serve 100% of your minimum sentence before you can be considered for parole.
We've heard from several clients that they've been denied parole because they can't have access to certain programs that they need in order to complete parole. That just really should be shocking to all of us, that people are not being allowed to come home because the Department of Corrections is not able to provide the programs they need in order to feel safe letting people home.
When we get these kind of cases, 9 times out of 10, there's a lot more to it. Maybe they were on parole before and got sent back. And so the parole board looked at them and said, you know what, you're just on parole and you broke the rules or committed a new crime and came back. We're not apt to just send you right back out. Or they got they got themselves kicked out of the class because they were getting a bunch of tickets or getting in trouble.
Green says every person should be afforded the ability to stay safe.
These, just because people are locked up, they're still human beings. We have people that are elderly, some of them that probably have aged out of crime, that have been there so long and with fragile health, that they should see about maybe releasing them to, space this place out. You can't social distance in a prison.
According to Gouts, the Department of Corrections are starting to see COVID cases go down and may have access to vaccines as early as next week. In Jackson, Joe Gebhardt, Fox 47 News.